Welcome back to another opportunity to accumulate health. So I think we have it backwards this month when it comes to Breast Cancer Awareness Month, the campaign that is built on increasing the knowledge about a disease, promoting early detection, screening, and showing solidarity through events like walks, runs, and illuminations on landmarks. What is this actually doing, though, to keep women from getting breast cancer and curing those who do get diagnosed? Seems like a lot of energy, a lot of money going out to the door, going into people's pockets, but not actually helping women. We want to actually help women, right? Not just create movement. As so often happens, something starts out good, promoting, we got to figure this breast cancer thing out, we got to conquer this. And it turns into all these people coming in, finding what? We can make a bunch of money by putting up pink things all over the place, by acting like we're helping these people out, when in reality, we're not moving the needle at all. We're not actually even letting women know that there's all these things they could do in advance of ever screening themselves or ever being diagnosed. They could do it when they're a teenager, when they're in their 20s, when they're in 30s, when they're in 40s, when they're in 50s, when they're in 60s. They could be doing all these things to minimize their risk massively so that we don't even need to think about doing all these early screenings and all of our time and attention going into the fact that, wow, we've been able to find breast cancer earlier. How about we put our time into attention into making it, we can't find breast cancer. We don't want to find breast cancer. Nobody wants to have breast cancer. No woman wants to have breast cancer. We don't want to find it in. So let's do everything we possibly can do to educate and create a world where breast cancer is not being diagnosed anymore. It's not being diagnosed more often. It's not 1 in 3 women. Let's make it that way. I've participated in the care of countless women with the diagnosis of breast cancer over the years, even currently. And what these women want and their families want and need is a resolution of their diagnosis without a litany of lifetime side effects and massive increased risk in heart disease and these kind of things. Even better would have been to have educated then that synthetic combined estrogen and progesterone birth control pills, that IUDs, progesterone-only pills, implants, injections, all these increase their risk of breast cancer. I think looking ahead as opposed to just reacting, let's do all the stuff that we already know in advance. Sure, it takes away a lot of money. People aren't going to make much money off prevention. There's no surgeries. There's not chemotherapy. There's not radiation. There's not all these new immunotherapies. There's not $50,000 a month going out the door with therapy as compared to eating amazing food, doing physical activity, sleeping, watching stress, all of the lifestyle endeavors. But I think we owe it to women to let them know, hey, you can actually do these things. You can actually have power. Power can be put in your hand to help yourself out, to help your daughters out, to help your mom out. Because you know what's better than getting diagnosed with stage 1 cancer because of early detection screening? Not getting diagnosed because the world you live in has been cleansed, purified of the agents that promote breast cancer. Breast cancer awareness. How about things that cause breast cancer awareness? How can a woman decrease her risk of being diagnosed with breast cancer? That sounds like a worthy cause. All right, so I got 5 for you today. 1, we can decrease or eliminate alcohol intake. I know, but one alcoholic beverage a day increases on average breast cancer risk by 10%. So as the alcohol intake goes up, so does the risk. Or 2, blast that extra fat your body's carrying around, especially abdominal. Now, there is convincing evidence that a state of obesity increases breast cancer diagnosis by upwards of 40%. That's crazy, right? So excess fat on the body promotes this chronic inflammatory state, insulin resistance, and undesirable estrogen metabolites, which tend to promote tumor growth. It is also important to not just yo-yo diet, go up and down in your fat accumulation and loss, because that is a reservoir for toxins. We're talking like dioxins, pesticides, metals, bisphenol A, flame retardants, just to name a few of them. And when you lose fat, these toxins are released into the bloodstream. You want this to happen one time when you lose the excess fat. If you're yo-yoing, you're losing it, gaining it all back, losing it, gaining it all back. Same thing's happening with these toxins. We're storing all these suckers. This is also why using habit transformation is where it's at for fat loss, as opposed to a quick fix, drop 20 pounds in a month routine. Because the body can't stay up with that detoxification when you're losing fat that fast. Toxins are just flooding the bloodstream. As always, consistent real food coupled with increased physical exertion is the place to live. All right, so next one, get moving. Because sedentary living promotes sluggish natural killer cells and decreases the responsiveness of T cells. These cells are essential for clearing out would-be cancer cells. And thankfully, just 150 minutes a week of brisk walking or 75 minutes a week of, say, CrossFit-like or high-intensity interval training can unwind the effect of sedentary living and reduce breast cancer risk by 30%. Next up is food inputs. I know, talking about food again, but a 2018 study in the British Medical Journal showed that with every 10% increase in ultra-processed, we're thinking chips, crackers, donuts, candy, fast food, coffees, there is a 12% increase overall risk of cancer. If you have a family history or a history of birth control use and haven't started eating broccoli sprouts, you got to check my videos on broccoli sprouts, as they are potent. Those guys, broccoli sprouts, they're such a blessing to the body and such an anti-breast cancer food. Really promote optimal estrogen detoxification. And right up next to that birth control I talked about, increasing risk, is all of these items in our life that are supposed to make things simpler, cheaper for us to live. Plastic water bottles, the plastic coffee-lined cups, the pesticide-laden foods, the glyphosate you're spraying on your lawn, the personal hair care products, the nonstick pans, the paper receipts, all are caustic. Drink out of glass, get her for ceramic or stainless steel. Yes, I would even bring my own cup to the coffee shop to let them put it in there for you. They'll be happy to do it. Cook using stainless steel or cast iron. Buy organic. It really does matter. For instance, Simple Mills brand crackers contain the pesticide glyphosate in the non-organic version, whereas their organic version did not. Is that crazy? So even that non-GMO sticker on there is not the same as organic. It does matter. Make sure your beauty products are phthalate-free and paraben-free at a minimum. If they don't explicitly state that on their label, I would pass on it. If you want a paper receipt, instead of taking that receipt, just snap a picture of it. Let it fall into the garbage. Holding that receipt just for 10 seconds has been shown to lead to the absorption of highly toxic chemicals that are far in excess of safety thresholds related to promoting dysfunction and disease in the body. Take these 5 things and go to work. Breast cancer is not a brand. It's not a marketing campaign. It's real women, it's real families, real fears, real loss. If you're going to donate money or time to the cause of the pink ribbons, I would find out what exactly am I promoting? What is actually happening? What has happened to the billions of dollars? Am I promoting just activity, just movement? Or am I promoting life-preserving actions that make breast cancer diagnosis less often, less common, and allow women who have been diagnosed to thrive to a greater degree? With the multiplied billions taken up each year in fundraising campaigns and product sales related to pink ribbons, it really seems reasonable that you could expect more forward movement. Then we can diagnose breast cancer earlier. Like, what is that helping? We're not doing anything to the disease. We're just diagnosing it earlier. For all the women who've dealt with this kind of thing, with breast cancer diagnosis, family members, moms, siblings, make your being, no matter what therapy you're going through, as healthy and strong as possible. Do not listen to the lie that food doesn't matter, that physical exertion doesn't matter, that your sleep habits don't matter, that stress doesn't matter. That doesn't matter if you go get a Frappuccino at Starbucks or you just get a drink a latte or a black coffee. It matters. It matters. Study after study, it matters. Our inputs decide how our body is going to manifest in life. Whether that's the stress inputs, it's the sleep inputs, that's the physical exertion inputs, that's the food inputs. It's the gene inputs from our parents. It matters. Take control of what you can control. And food, your plastic water bottle, your physical exertion, when you're going to go lay down at night, these things you can control. Go for it. All right, I'm Dr. Matt. See you guys and gals next week.